Hi everyone, thanks for tuning into this video. Today I'll be going over the importance of regularly performing breast and testicular exams at home and how to perform them. It is important to practice breast health awareness because becoming familiar with your breasts and knowing what is normal for you will help you detect any changes or abnormalities. In order to achieve this, it is recommended that you regularly perform a self-breast exam once a month. But remember, with regular self-exams, mammograms are still recommended because a mammogram can detect any tumors before they can be felt, so screening is key for early detection. So how does one perform a breast self-exam? These exams can be performed in one of three ways. 1. In the shower. Using the pads of your fingers, move around your entire breast in a circular pattern, moving from the outside to the center, checking the entire breast and armpit area. Check both breasts each month, feeling for any lumps, thickening, or hardening knots. 2. In front of a mirror. Visually inspect your breasts with your arms at your sides. Next, raise your arms high overhead. Look for any changes in the contour, any swelling or dimpling of the skin, or any changes to the nipples. Next, rest your palms by your hips and press firmly to flex your chest muscles. Left and right breasts will not exactly match, so look for any dimpling, puckering, or changes, particularly on one side. 3. Lying down. When lying down, place a pillow under your right arm and your right shoulder, and put your arm behind your head. Use your left hand. Move the pads of your fingers around your right breast gently in small circular motions, covering the entire breast area and armpit. Use medium, light, and firm pressure. Squeeze the nipple, check for any discharge and lumps. Repeat these steps for your left breast. If at any time any abnormalities are discovered, it should be investigated by your healthcare professional. Here are some symptoms to look out for. A change in how the breast or nipple feels, nipple tenderness or lump or thickening in or near the breast or underarm area, a change in the skin texture or an enlargement of pores in the skin of the breast, a change in the breast or nipple appearance that includes any unexpected changes in size or shape, dimpling, any shrinking or swelling, or any asymmetry of the breast, or any swelling or redness that has occurred. Any nipple discharge, particularly clear discharge or bloody discharge. Although it may not be linked to breast cancer, it is not normal for women to have nipple discharge when they are not breastfeeding. If you have any questions or are experiencing any of these symptoms, you should talk to your healthcare provider so that the problem can be diagnosed and treated. Testicular self-exams. Research tells us that monthly testicular self-exams are important to notice any changes. By doing monthly self-exams, you should become familiar with your testicles, and that'll make it easier to notice any changes. Testicular cancer can develop in one or both testicles. Most tumors are metastatic, meaning that they can spread to other organs, possibly leading to serious illnesses or even death. Although testicular cancer is rare, it is the most common form of cancer in men ages 15 to 35. Testicular cancer is one of the most treatable cancers, especially if caught early. Most testicular cancers are found by the men themselves or their partner. Very few are found by a physician. This is why it is so important to be familiar with what is normal, and if you do notice any changes, to see a doctor immediately. How to perform a self-exam. 1. Stand in front of a mirror. Check for any swelling on the scrotal skin. The best time to self-exam is after a warm bath or shower when the scrotal skin is relaxed. 2. Examine each testicle with both hands. Place the index and middle fingers under the testicle with the thumb placed on top. Firm but gently roll the testicle between the fingers to feel for any irregularities on the surface or any texture of the testicle. 3. Find the epididymis, which is the rope-like structure on the back side of the testicle that collects and carries sperm. Look for any lumps or irregularities. Remember that lumps or bumps may present themselves as painless. Look for any changes in size, shape, or texture. Remember that it's normal for one testicle to be slightly larger than the other. If you notice any lumps, bumps, or irregularities, see a doctor right away. Keep in mind that not all lumps and irregularities are cancerous, however, only a doctor can make that determination. Waiting to see if it'll go away will not help you.